Hi, I'm Dr. Courtney, and welcome to Vet Candy Suture Skills. Just going to be a quick and dirty guide on how to suture. This little suture practice kit that I'll be using today is nice. It's beautifully color-coded, so you can see the layers. The deepest layer is red, representing muscle. Then the yellow represents the adipose or fat, subcutaneous fat. And then, of course, on top here is the skin, without melanin, I might add. But no, you get a nice pair of Mayo Hager needle holders. You get these DeBakey forceps and some scissors. I'm gonna pull out my needle driver here and my forceps and some scissors that we already have and some silk. And we're just gonna talk about, we could talk about different types of suture, but that's for other videos. Today, I just wanna talk about the fun stuff, which is suturing. So let's talk a little bit about needle holders first. Needle holders do exactly as the name implies. They hold your needle, but they also help you grasp the needle as you pull it from tissue securely, and they also help you manipulate the curve of the needle through tissue. Now, remember that little nuance, the curve of the needle, because we're gonna get back to that in just a second. The type and the size of the needle holder are pretty much determined by the characteristics of the needle that you're suturing. For example, if you're dealing with a larger needle, you really want a wide, heavy needle holder so that you can hold the needle appropriately. And conversely, if you're using a needle holder to hold suture, you're gonna find that the jaws are very finely serrated or they're smooth, so you don't actually damage the suture itself. And of course, if you're working in a very deep cavity, you're gonna want a really long needle holder, like in the case of doing a gastropexy in a Great Dane, or like what I was doing last night, which was repairing a traumatic abdominal wall hernia in the intrapelvic region. I had to really dig down in there. So it was good to have a long needle holder. And I would say the Mayo Hager needle holder is the most commonly used one in veterinary medicine, and it's for manipulating fairly coarse or medium-sized needle. Olsen Hagers are nice too. They come with a little blade or scissors in them, so you can cut and grab your needle with the same instrument. However, listen, even the best surgeons have accidentally cut their suture using Olsen Hager needle holders, so be careful if you get a pair of those. There's a variety of ways to hold needle holders, and depending upon who you are, it may feel more comfortable to hold them in a certain way. My only suggestion would be to practice consistently. Just use one way consistently to get a foundation before expanding to other techniques, because in a stressful situation, or let's say you're doing something delicate, or if you need to go fast, or something like that, you could always lean on your old standby, the type of way that you've practiced the most. And so it just provides, like I said, a foundation so that you can build on your skill set from there on other types of grips. So there is the palm grip, right, where there's no fingers in the needle holders whatsoever. And this is where you can just manipulate. Then there's the thenar grip, where the ball rests exactly on the needle holder and you have your ring finger in that. That's the thenar grip. And then you have the thumb ring finger grip, like here, where you have your ring finger through one of the rings of the needle holder and your index finger is on top. And the pinky does a lot too. If you combine the pinky with the index finger, it does provide that line for balance, kind of like a rudder on a ship and where you need to go. The pencil grip, which I'm not going to show you today, that's if you're using a Castroviejo needle holder. So let's talk about the palm grip for a second. The palm grip has a couple of advantages. It allows you to drive through very tough tissue, and it gives you more mobility if you like to flip your needle holders. If after grasping the needle, you can flip your needle holder. The only disadvantage is that you can't easily release and re-grasp your needle without having to switch to a different grip. And this potentially can cause issues with exactitude and precision. As for the thenar grip, the advantage of the thenar grip is that you can release the needle and re-grasp the needle without having to change grips. And this gives you great mobility, but the needle holders tend to pop apart, like they just spring apart. And that can have real life implications if you're near really large vessels. I will either palm the needle holder like this, or I'll use the thumb ring finger grip like that. And if I'm suturing something that's not, let's say, technically demanding, or I need to pass the needle through really tough tissue, I'll palm that. And it gets you some finesse, but with controlled power. In general, I will use a thumb and ring finger just because it allows me more precision, and and better tissue handling, and that's what this is all about. Just a quick word about tissue forceps. There's a variety of tissue forceps, including the Brown Adson, the Bishop Harmon, which can be smooth or toothed, the DeBakey's, which are what I'm using here, and the Adson Browns, which are typically used for skin. I view them very much like tweezers. The grasping ends remain open and you squeeze them to keep them shut. There's a host of different types, shapes, and sizes, and they generally all have varying tips. Generally speaking, I use DeBakey's for delicate tissue like intestine or blood vessels. Brown Adson or Adson Browns can be used if you need to hold skin, because you know that because they have teeth. And my recommendation is to avoid using them to hold skin, but if you have to use them to hold skin, definitely reach for your Brown Adsons or Adson Browns, and you hold them in your non-dominant hand. Use the instruments kind of like an extension of your fingers. So act as if you were trying to pick up tissue with your thumb and index finger, and simply imagine if your thumb and index finger had extensions on them, and then they're essentially an extension of your hand. My preference is to hold them using a pencil grip, because if you hold them in the palm, they're just not as maneuverable. And I will only palm them if they're not in use. You can certainly use these forceps to grasp the needle, but that's not actually their true intention. Their intention is to hold the tissue as you place the needle through, or you can use them to expose tissue that you'd like to suture. So take the tissue and place it over the needle. For example, let's say you're closing the subcutaneous layer and you start on the opposite side. See how I'm pulling the skin over? That helps. You can use the forceps for that. And then I grasp the needle again. And then as you are gently lifting that tissue, you watch that exit as you pass your needle through. And then once you re-grasp your needle, now you can expose the other tissue layer on the near side and actually aim for the target. And so I'm gonna come through, and now I've aimed for the target, I re-grab my needle, and essentially I'm gonna pull through until I feel like I have a sufficient tail in this. And this, if you palm the needle like this, if you palm the needle holders like this, once you take a bite like that, and you come through and you just use the needle to push through just a little bit more, and you re-grab the needle, now you don't have to re-grip the needle. You can just turn the needle holders like that, and that's the advantage of palming. But if you use a thumb and ring finger grip, once you come through the tissue, it's so important to immediately re-grab your needle as soon as you're coming through the skin. That way you're ready for the next bite. If you try to do it up here or in space, then it's going to be a lot more difficult to find your needle, and it's not as efficient, and it's certainly not as exact. Ideally, when you're grasping your needle, you want them to be perpendicular to the needle, and you want to go about 2/3 back. In general, when you are placing your needle through the skin, the needle doesn't always come out exactly the way where you'd like to, and also sometimes the needle doesn't come all the way through the skin. And so yes, here in this model, as you're placing the needle, you can push it through exactly where you want, but in a lot of patients, the needle doesn't come all the way through the skin the way you'd like to. We're gonna go over the types of sutures and the needles and all that fun stuff in a later video, but this one, I just wanna get to the fun stuff, like just how to suture. So let's talk about how to put the needle on the needle driver. You want it, as we were just saying, at about a 90-degree angle, and some surgeons will put a little bit of a forward angle on that so that the arms can triangulate to a certain spot that they're trying to suture. I prefer to be at a 90-degree angle to what I'm suturing, but that's my personal preference, because I like to follow that perpendicularity. But now onto the needle driver. You want to put your thumb and your ring finger in the needle driver. If you're doing the thumb ring finger grip, you don't want to use the middle or your index finger. And as we mentioned, the other way to do it is to palm the needle driver, which gives you more degrees of freedom because then you can actually twist the needle driver. But when you're starting out, you just want to practice one technique many times before you move on to the next method. Now this DeBakey forceps is specifically designed for delicate tissues like intestine and bladder. And so here we go. I'm gonna try to close this incision right here. And I'm gonna take the needle driver and I wanna put my finger as close to the tip to the needle driver as possible. That actually makes the tip of the needle driver more steady and thus the needle itself more steady. And the more things that you can rest your hands on or your elbows, your wrists, the more steady you're gonna be. And when I place my needle, I'm gonna turn or twist my wrist like this and turn the needle. So it's going about 90 degrees to the skin. And once it's in the depth that I'd like, I twist my wrist and I see the needle come out near the intended target. You really want to use the curve of the needle. I can't emphasize this enough. You don't necessarily want to muscle the needle through. And you can close this incision with 1 or 2 bites. In this one, I just did 1 bite. And notice what I'm going to do here is pull the needle out just a little bit. And when I'm going to grab the needle where I want to grab it, it's going to be about 2/3 back, okay? Now that I have the needle exactly where I want it, this is the advantage of palming because I can pull it up slowly, twist my wrist simultaneously, and I'm actually ready for the next bite. Again, notice that I'm palming this needle, which is why I can make this move. Once I put the needle in the second side, I can go ahead and pull the needle out, and I really don't have to hold the needle with my forceps. In an animal in which the tissue is stable, you can definitely use this technique because it helps you to avoid holding the needle with forceps. You can just rotate your wrist. You can only do this if you hold the tissue in place or if when you let go of the needle stays in place. Most of the time, the elasticity of animal skin will not allow you to just put the needle through the skin and have it stay in place. The tissue will essentially move back over your needle. And when you can't see your needle because it's under the tissue, it will give you a sinking feeling because you always want to be able to visualize the tip of your needle. You don't want it lost under the skin. And that's why I heavily advise you to grab the needle before letting it go. You could be suturing in a very deep cavity, or you could be suturing in the abdomen or in the throat or in the chest. And if you let go of that needle, I've certainly seen situations where the needle retracts back under the tissue and it's a bear to find it. And the consequences of having lost a needle could be disastrous. In addition to that, it's also important to know that different species have different levels of skin elasticity. Young or old, cat, dog, horse, hedgehog, they all have different levels of elasticity. And I mean, anyone that's sutured the skin of a greyhound understands that their skin can be super fragile. They even, take for instance, even a medical condition like cutaneous asthenia, where you've got this hereditary disorder that makes the skin unusually stretchy and droopy. And a lot of times these animals, or the essence of the condition is that these animals have a deficiency in collagen and the skin won't return back to its normal position when it's stressed out. So my point is suturing in veterinary medicine can be very different than human medicine because of the species differences and the breed differences. So back to the needle. I'm going to place it at a point where I feel comfortable. So I'm going to take 1 bite here, another bite there. And as I come through, I'm not going to take another bite because what I'd like to do is I'd like to tie this, okay? Some people will pull this above their shoulder or in the air like I just did a couple of seconds ago. And if you do that, you're likely going to touch your face or someone else's face, or you're not going to be sterile anymore. So here are 2 tips, right, that I do in surgery. One, you could put your forceps in the middle and pull over your forceps like that until the tail is shorter. Or what you can do is, what I do more commonly is I will gather it in my fingers and I'll do the over-under technique where I come over the index finger, under the ring finger until the suture's sticking straight up, which will help you with knot tying later. And when you gather your suture like this, you need to be very cognizant of where your needle is, which will help you get ready for the next bite so you know where to grab it. And you also don't want to poke yourself in the hand. And I try not to let the needle just kind of like float freely because who knows what it could snag or pierce on. So what I do here is I grab a couple palm lengths here or needle holder lengths of suture, and I'm palming the forceps, in my left hand here. And all I do is I put the needle driver in between the tail and the length of suture. And for a surgeon's knot, I usually do 2 throws or 2 loops of suture. And the surgeon's knot helps with tension, and depending upon the study you read, it's just as secure as a traditional square knot. So what we're going to do right now is start tying our knot, and notice how much length I have, okay? For those who are just starting out, they may sell themselves short with the amount of suture that they're trying to tie. And if your loops are too tight, then you won't have enough room to tie your knot, or there'll be too much tension and the suture might get caught in the jaws. It's just bad news. So make 2 big loops, and I place my needle holders in the center of the suture, and then I'll pass the suture in front like this, 2 big loops like that. And now if you're able to grab your suture end, and it's not too tight because I'm just approximating the skin edges. You don't want to strangulate the tissue with the suture, and you also don't want to invert the skin edges because inversion results in poor skin healing. And sometimes to help the suture from coming out from my next throw, I'll actually just pull up slightly. But if it stays in put, that's excellent, because when I place the second knot here with one throw, I'm going to pull up on the suture just slightly to determine the distance from the suture to the skin. And then for the last, I'm going to place my needle holder in the center, and then I'll make a big loop and err on the side of it being too big. I'm just going to tighten this a little bit more, nice and tight. And then I'm going to basically secure my knot. And I'll just practice putting on way more throws. I usually stop at 3, but I'll just put here, again, center, turn, center, turn. So once you're done with that, then you can go ahead and cut your suture. Okay, now if I'm doing an interrupted suture, I'll typically do 3 throws. So we'll just come through, we'll grab our needle, we'll come through here, use the curve of the needle, and I'll typically do about 3 throws. It's important to know because the knot is the weakest point in the suture loop, and under distraction, the knot experiences considerable shear stress, and the knot will cause the suture to fail in that area. Tying a knot actually decreases the suture's breaking strength by 30 to 35%. And in laboratory tests, the knot was the site of failure of the suture in 93 to 100% of the time. So how many throws is enough? Well, a key study found out that 4 to 5 throws is adequate. Their research found that no suture really needs more than 4 throws to make a secure square knot, and some only needed 3. And so if the goal is to bury as little suture as possible, then there's really no need for 5 throws. Just be careful to make sure that each knot lies on top of one another without including any fat, and keep the suture ends parallel to the knot that you're tying, or sort of perpendicular to the incision. Because if they're done in a crisscross-wise fashion, it creates a granny knot, which is weaker, and it could lead to dehiscence. If you want to determine where to place your needle into the dermis during further bites, simply place your suture across the incision at a 45-degree angle, and where the suture lies, that's where you take your next bite, or you can just go a little upstream from that. And there's always exceptions to the rule, but in general, I would say try not to manipulate tissues with your fingers and use surgical instruments instead, because that's what these instruments are here for. But every situation is different, and you just want to be gentle if you're going to manipulate the tissues with instruments. The knot we just practiced tying is what I call a simple interrupted knot, and there's a host of different knots, including half hitches, tumbled knots, granny knots, just to name a few. We can go over those in the next video, but for now, the surgeon's knot and a square knot are going to be your bread and butter. So be sure to just practice those. If you practice anything at home, practice your square knot and your surgeon's knot. But now I get to talk about something really exciting. I'm just going to quickly go through my 5 favorite suture patterns for skin. Let's do the simple interrupted. It's the old standby. If you are ever having trouble with skin apposition, you can always just go back to basics. This simple interrupted suture. And that's the one we literally just did. So let's just go quickly here. Again, use a thumb and ring finger grip. Some like to palm the needle holders so they can get more rotation. And here what I'll do is I'll just take one bite across the incision like this, and I'll do it all in one bite. If the distance is too much or the skin is too thick, you can re-grasp your needle in the middle and then go for a second bite. Or if the skin isn't too thick, you can just do it all in one bite like I just did here. And you may have to hold the tissue in place as you pull your needle so it doesn't get sucked back underneath the skin. So after you've made it through the skin, you can hold the skin to keep the needle in place, or you can hold the needle. If you choose to hold the skin, use your needle holders to push the needle as far enough through the skin so you can re-grab it. When you re-grab it, grab it 2/3 of the way back. And if you're using a palm grip, you can then rotate the needle holders for your next bite. But if you're a needle grabber like I am, then this tip is really important. When you grab the needle and you come through the skin here, use the curve of your needle to come through and immediately re-grab the needle. Grab it like that. That way you're not trying to grab it in space, which can be very, very challenging. And so as you're coming through, again, I like the over-under technique, over, under, until your tail is about 2 centimeters long. Then 2 big loops, grab your end, again, pull perpendicular to the incision, and then again, and again, and again, and again, and again. And now you've secured your knot, you can go ahead and tie it. My second favorite suture pattern for skin is the cruciate or figure 8 suture. And you're gonna start this suture the same exact way you did with the simple interrupted, but you're gonna take 2 bites instead of 1. And as I'm taking the first bite, notice that I'm gonna re-grab my needle very close to the skin, right? I'm gonna use the curve. I'm gonna use the curve of the needle, come through, re-grab very close to the skin. And I'm gonna go in for a second bite here and use the forceps. Go in for a second bite here. And as I use the curve of the needle to come through, I'm gonna watch the skin edges come together, right? And you don't want them too tight, just apposition, because you wanna leave room for swelling. A lot of times to prevent that, I'll put my needle holders in the middle, and then I'll cinch them down on top of the needle holders, and now they're not too tight. Again, center, 2 large loops, grab your end, and then pull it through. And as I do it, I'm watching the skin edges come together to make sure that I have good apposition. And if they don't want to stay put, if the skin pulls them apart, a lot of times I'll pull up on the suture itself just to keep it in place, and then I'll create a second knot. And again, I'll pull up on this knot too, because look what that does. Look what that does. It actually gives me a little bit of space for swelling so that the sutures don't end up too tight. And finally, I'll put on a third knot to secure it in place, okay? And that is your cruciate. And you can see they call it cruciate because the sutures cross, or a figure of 8. This is a really handy suture pattern to use because you get a little bit of the speed because you take 2 bites, but also you get the security of an interrupted suture. The advantage of this interrupted pattern is the strength of that interrupted pattern in case one suture comes out, your entire line doesn't come out. But then also it provides you a little bit of speed, because ultimately this is a little bit faster than in a simple interrupted, but not as fast as a simple continuous. So that's an ideal cruciate suture pattern. I'll leave my tails not usually this long. I usually come by and possibly trim them just a little bit shorter than that, depending upon the patient, depending upon exactly what I'm doing. But I like that length. One of my favorite suture patterns for skin is the inverted cruciate, and the reason why I like this suture pattern so much is it does a really good job of getting the skin edges together. Basically, instead of the X being on the surface of the skin, the X is below the skin or in the subcutaneous space, is why we call it inverted. And I think it does a better job of skin apposition, and the tension is actually perpendicular to the incision. So it doesn't twist the skin like cruciate sutures do. The way you do it is you take a bite at an angle across the incision, and I'll just do this one here. Take a bite at an angle across the incision, use the curve of your needle to come through, and then as you come through, I'll regrasp my needle here, and then take another bite and go directly across and up on the opposite angle, like that, okay? And as you come through, regrasp your needle. Once you come across, again, I like to place my needle holders right in the center to help determine tension and to make sure that it doesn't cinch down on the skin too tight. And I'm just, obviously in this model, there's a little bit more friction, but I like it because what it does is it helps this suture tail stands straight up. And so when you tie your suture again, center, 2 large loops, grab your end, and then when you tie it, you see how the skin edges just come together. See how that apposition just is beautiful on that skin, comes together again in the center, and then tie your suture and secure your knot with a series of throws. What I like about this is it doesn't tend to twist the skin. You see that the X is underneath the skin. And also, when it comes time for suture removal, you take your suture scissors, you simply, this one doesn't have a hook here, but you simply hook that and you remove it and the entire suture comes out. So veterinary surgical nurses will also like this suture pattern too, because suture removal is very simple with this pattern. And there you go. There you have your inverted cruciate. Vertical matches. This is a great suture pattern if you want to decrease tension on the skin. The skin hates tension when it's trying to heal. So this is a great option in those situations. Now, so to place a vertical mattress suture, you want to actually start pretty far away from the skin incision. You want to start about 8 to 10 millimeters away from the incision line. And I'll pass it through until I get to the opposite end. Now, we run out of room a little bit here, but you'll still get the point. All right, and so once we've come through sufficiently, and you've come through and you've exited the opposite side, then you insert the needle on the exact same side that you've just exited. Use your forceps to keep the suture in control here, and you come through this side. Again, grab your needle in the incision, use the curve of that needle. You can regrasp here, like that, and then you come through again at this stage and pass your needle through. Now, once you've come through sufficiently, you'll notice that the skin comes together nicely. You have your tail that sticks up. You want to take 2 loops and then just gently bring the edges together. And you see how the suture takes up a lot of that tension. And once you've secured that, you create a second knot. To secure it, you want the skin edges just in that position. You don't want to squeeze them, and then your third secures it. What's great about the vertical mattress is that it doesn't disturb the blood supply like the horizontal mattress. It also has pretty good skin apposition. It decreases tension. I also like it because you can use buttons with it or stents with this, but to be sure, if you are experiencing tension on the skin, utilize a variety of options like near far, far near, or stents, or a plasty technique, or a flap technique. But certainly this technique with the vertical mattress can help alleviate some skin tension. Another one of my favorite suture patterns for skin has a great name. It's the Halsted pattern. It's not really used in veterinary medicine very much, and it can be useful in situations where you're having trouble with skin edge approximation. The Halsted is an interrupted mattress pattern that looks similar to a Lambert, but we can talk about Lambert in another video. What's really interesting about this pattern is that the needle enters and exits the same side of the incision. The needle is passed, I want to say you want to start about 5 millimeters from the incision and use the curve of your needle and find an exit right on the same side of the incision. I usually regrasp my needle here, and then I'm going to enter. You're going to cross over the incision and repeat the same process in reverse. 3 millimeters from the skin edge at first, and then 5 millimeters from the skin edge. And I'm just going to come up a little bit higher. I didn't like that. You can always adjust. And once you've completed on the other side, like that, you can tie your suture here, or you can adjust your needle. And a lot of times what I'll do is I'll use my forceps to do that. And I'll actually come through this way, exit the same side here, come through with your needle, adjust your needle here, and come through on the exact same side, just like that. And now you have 2 lines of suture that are putting really nice horizontal tension. You can keep your tail long, or you can cut it, totally your choice. But essentially 2 loops for a surgeon's throw, and you're going to apply parallel tension, parallel to your incision line. Again, the second throw determines the distance from the suture to the skin, so you allow for swelling, and then the third secures it, just like that. And you can cut your tails. Okay, that's how to suture from a veterinary surgeon. And thanks guys so much for watching, and I'll see you on the next one.